heard earlier in the newscast that Indiana health officials sounding the alarm over rising COVID numbers around the state. And we wanted to get a clearer picture of the COVID crisis in our local hospital. So we reached out to Deaconess, and Dr. Brad Scheu, the Chief Medical Officer of Deaconess Clinic, joins us now. We appreciate you taking the time today, Dr. Scheu. We have covered the numbers over the last several days, and we know that there's a marked difference between unvaccinated and vaccinated people. Who are you seeing more in the hospital at this time?
Well, we're hearing a lot of people calling this the pandemic of the unvaccinated, and we're definitely seeing that here at Deaconess. About 85% of our patients in the hospital with COVID are unvaccinated right now.
So that's a huge difference of folks that are unvaccinated being treated in the hospital. Once they get in the hospital, are you seeing a difference there as far as the way they respond to treatments? Are the symptoms more severe? That type of thing?
They are. So some patients that are vaccinated have ended up in the hospital. Those with severe illness, meaning those that end up in the ICU, or worse, those that require a ventilator. By and large, the proportion of those are the unvaccinated patients. So those that have not been vaccinated are having much more severe illness than those that have been.
Now, despite what you're telling me, I have been hearing people who say that these breakthrough cases that do end up in the hospital show that vaccines don't work. What's your response to that?
So again, looking at the data, you'll be able to see that when 85% of the patients in the hospital with COVID are those that are unvaccinated, it's showing you that that vaccine is really helping prevent the severe illness, which is really ultimately the goal. We don't want to have patients dying from COVID. We don't want to have patients on ventilators, on life support, and in the ICUs. And we're clearly seeing that the vaccine is helping prevent that. No vaccine is perfect, but this vaccine has done a great job preventing severe illness.
Now, of the patients, the COVID-19 patients being treated, how many of them are otherwise healthy and contracting COVID, and how many had underlying conditions?
Yeah, with this round of this surge with the Delta variant, we are seeing a much younger population. In our community, the older population has done a great job with getting vaccinated. So as this variant is finding the unvaccinated patients, the majority of those have been younger compared to the previous surge. And it is affecting people that don't have as many comorbidities or other medical problems like we saw the first time around. So it's hard to give an exact generalization, but in summary, we are seeing younger and healthier people end up in the hospital as a result of being unvaccinated and getting the Delta variant COVID.
So it sounds like it's very different, as you said, than the first time around before the Delta variant, when it seemed like people with diabetes or who were overweight really were more susceptible to COVID-19. It sounds like this Delta variant doesn't care. It's hitting everyone.
That's exactly right. Now, we're still seeing some with those other chronic conditions get ill as well. It's not really, picking and choosing where it's going. It's just going where the path of easiest resistance. And right now, that's typically the younger and healthier and unvaccinated patient.
When you say younger, how young are we talking about? Are you talking about children? What's the youngest age that's in the hospital right now with COVID-19?
We have seen children in the hospital. We don't have that right now, but that data changes every minute and every hour. But we have seen some cases of pediatric COVID here in our community. We're seeing some of the largest groups is that 19 to 65 or even 19 to 44-year-old range. That's a much bigger group this time around than it was the first time we had a surge in our community. So just overall, it's a much younger population in the hospital.
Does age make a difference in how well someone can be treated and recover?
So in general, the younger and healthier you are, the better chance you have of getting through COVID and making it out of the hospital to full recovery. So that is the good news for that younger population. But we are seeing young patients have really severe disease as well. So I think the bottom line is just do not chance it. Get vaccinated. We don't want to meet you in the hospital because of the results of you having COVID, and we could have prevented that.
Dr. Brad Scheu, Chief Medical Officer at Deaconess Clinic, thank you so much for taking the time today to paint a picture of the situation hitting our hospitals right now. We appreciate your time.